Hello, I am Himanshuray from India. I am taking your 20 minutes to present a study, a video on Telegnosis. I recollect that in past, in 1954, Dr. Carl Jung, the famous psychiatrist, made a very sincere effort rather, to establish correlation between astrological methods and medical diagnosis. But I understand that it was a failure. I am confident that it failed because it excluded certain methods of astrology which are known as Svar Shaastra, Lakshan Shaastr, Chhaayaa Shaastr, Risht Lakshan of Ayurved, and Aaroodh system of astrology, which we have taken into consideration this time. And after good 69 years of that study of Dr. Jung, Dr. Saurabh Chokshi of USA has made this video which I am going to play to you. It takes into consideration all so many new factors in that, and the accuracy rate is as high as 61%. And I request you to note that the input given to the Telegnosor was just the age and the gender of the patient sitting by Dr. Chokshi in Florida. The answers were sent to him over WhatsApp or SMS just within 10 to 15 minutes from a distance of about 8,000 kilometers. Please watch the video. Please watch the video.
Hello, everybody. My name is Dr. Saurabh Chokshi, and I am here to present a study on Telegnosis that I've prepared for participants of certified course on Telegnosis that is conducted by Mr. Himanshuray Raval. Let me introduce myself. I reside in USA, in Tampa, Florida. I'm here since 1981 in USA. I'm a professor in cardiology in University of South Florida for past 33 years. Also a director of cardiac catheterization laboratory that I served there for 26 years. I see a lot of clinical patients, teach cardiology fellows, residents, write papers, publish papers, make presentations, give talks. So very much involved in academic cardiology, so to speak. And in January 2022, Mr. Raval approached us and asked whether we can participate in this study of this art on telegnosis, which I had no idea what it was initially. And he gave a nice presentation. We started learning a little bit. Of course, you guys are learning much more than what even I know. And then to really get the validity of this 5,000-year-olds or maybe older ancient art into modern medicine, we embarked on this sample study that I'm going to present here. To my knowledge, this is the first patient study in USA, and under the guidance of Mr. Himanshuray Raval, Dr.Arti Shah coordinated this study, and two physicians from USA, myself and Dr. Melinda Tony, participated in this study, and Dr. Sunil Pandey, who has a lot of experience with Himanshuray in India regarding telegnosis, advised us initially how to conduct the study and how to proceed about this whole thing. Let me go over the protocol. We took random cardiology clinic patients, and because of the liability issues and malpractice, etc. in USA, we had to pursue informed consent, which is a elaborate one-page long. Time doesn't permit to go over the consent, but uh, in that we explain what we do. We don't give their name, but we also give the clinical data and correlate all the telegnosis finding with the current condition that can help, and that they will fully participate and also participate in the interview so that we can pursue appropriate data collection. Then I would just evaluate the patient routinely, like I would see any patient. And at the end of my evaluation, while my patient standing next to me, and I would of course inform them, I would send the WhatsApp message to Mr. Raval, and this would be the message: age and sex of the patient. That's it. Example, 21-year-old male patient, that he would assume I'm standing next to them and I need to get information. Within 10 minutes, I would get a written paper from Mr. Raval describing the patient condition, diagnosis, care plan, prognosis. Usually it would be like 8 to 10 points. In some cases, pertinent issue that might be important to consider, that he would also write it down. So in most of the time, considering the time difference and so forth, we were able to get this data rather soon. So how did we do data collection and analysis? Once I received the information from Mr. Raval on my WhatsApp, I would take down all the information, absorb that, go into detail, correlate with some of my patients' data, looking at the broad validity, so to speak. And then I would have the interview with the patient, and I'll go over point by point each data points that Mr. Raval presented. Say, for example, the data received from Mr. Raval says patient has some family issue with the spouse. I would directly ask the patient regarding the same, or problem with the vision, or problem with the back, or certain areas of the body having some discomfort. Whatever is written, I would just somehow confirm it, of course, in my clinical context. And after that, if the answer to the question, many of the times is like black or white. So is it correct or incorrect? But sometimes it's close to correct or close to incorrect. I would have to make the decision, because we did not weigh the scale from 1 to 100 or 1 to 10 or 1 to 5. We mention either correct or incorrect. So it's black or white. So it's very important to understand that in many situations, it is not 100% correct, but it's like 80-90% correct, close to correct will make it correct. After that, the correct test score was tabulated in each patient. So let's look at the 15 patients that we studied. As you can see in the graph, you have patient number 1 all the way to 15, and it's random, that you can see sometimes a score up to 100. Like in this particular graph, we see 3 patients having almost 100% correctness, and 4 patients 80% and above, and 3 patients close to 50%. But there are 2 patients where less than 20% correctness. It was very interesting that the patient, when there was a couple points were incorrect, almost the entire things was incorrect. So I do not know whether there is in some way of transmitting the data or what the method is, that of course Mr. Raval has to solve, but that's something that I observed, that in some patients it was fairly low, close to 10 to 15%. So when we range it, it's like between 14% to 100%, and the mean was 61.46%. So the most important thing is in the patients where there was 100% correctness, all 8 or 10 points that are presented as far as the patient condition is concerned, patient's social situation is concerned, patient's compliance with medication, treatment, prognosis, outcome, all 100% things were correct. And some of them was very, very impressive to me. So let's take one example, patient NN, and let's go through some of the aspects that Mr. Raval has written out. So, number one is a problem related to auto accident. So in this situation, patient was in bed for 6 months after auto accident 3 years ago. Number two was a break in communication with lady older than him. So in this case, the patient had a major communication issue with the wife for the past year, and clearly the wife is 6 months older, so then that's a lady older than him. The third thing was lack of support from female partner, intensifying clinical problem of the patient, and it was absolutely correct because the patient had elevated blood pressure and increased angina, heart pain, chest pain over the past year since this communication gap that surrounded around the children, basically. So I talked to the wife, I counseled her, because as you know, I had gotten the informed consent, and she was in tears and promised to support him. And just as a follow-up, 3 months later, his blood pressure became so much better because now they sort of made up. So the next issue was that heart issue due to genetic inheritance from mother. Of course, I can take the family history and easily tell the patient about this, but to diagnose this genetic issue from 6,000, 7,000 miles away was very impressive. In this case, the mother died of heart attack at age 58. And last thing was patient may not complete the treatment. And this patient was non-compliant, and he was counseled to take more medication, appropriate medication at appropriate time, also regarding the diet, lifestyle. And he's not 100% better, but clearly there is made a difference, because when I mentioned that even it is written in the ether that he's not compliant, the patient really took this very seriously. So how did telegnosis help me as a physician in my practice? So first is the diagnosis. So let me give an example of one patient. It's a 21-year-old patient. I recently referred this patient for aortic valve repair surgery at Cleveland Clinic here. And when I saw him initially in 2022, Mr. Raval has predicted the patient had left hip injury and the left eye weakness. So I asked the patient, and this young man told me, no, I don't have any problem with my hip. I don't have problem with my eye. But I told him to get this checked out. So they got an x-ray, and he had a heel fracture of the femoral head because he's doing competitive basketball. So that has caused the injury. And he went to the opticians. We had not gone for a long time, and his left eye myopia was corrected. And he's very thankful when he came. The second thing was many times the prediction that multiple surgeries and in exact number, like in this patient, prior multiple surgery, 3 ablation procedures were done. Another patient had worries about the job because she was doing 2 jobs. So I would not have asked the question whether she's doing 1 job, 2 jobs, but because this particular thing came about, I went in detail for the job history and so forth. So that really impacted the care on this patient and how I would counsel the patient and so forth. The third aspect was the treatment aspect. Many times he had recommended, Mr. Raval has recommended, get the sonography done, which many times we do it, but in this patient we did not do the sonography for last 3-4 years, as it's not routinely done every year. And when we did the sonography, that was a major change. Now the patient had newly diagnosed pulmonary hypertension. So that was important. The next one was medication might not suit her. So if I put her on a new medication, then I generally do muscle testing, um, which is a totally different field. But many times I do muscle testing we call a ring test to get it to the patient. You can look it up on internet or Google. And so I made doubly sure that before I give the medication, I do the muscle testing and be careful about a new medication that I put in this particular patient. And of interest, this particular patient where he has mentioned medication might not suit her, she's allergic to 16 medications. So that was a very interesting corollary. In many patients, he mentioned increased water intake for low blood pressure. And so in this particular case, I would give them advice to hydrate themselves and drink Gatorade, Powerade, electrolyte solution, and so forth. And the last thing was the prognosis. Like in one patient, he mentioned that he may need major surgery in 180 days. So when I read this, I said, there's no way he's going to need surgery in 6 months. However, in the follow-up, the patient needed, he's a retired psychiatrist, he needed a stent in the heart, coronary stent, after having an unexpected heart attack, because we didn't expect that even a month before his heart attack, his stress test was normal. So that was an interesting finding to really kind of keep much more closer surveillance. So let's say if I was going to see the patient in 6 months, if I get the information that he might need surgery in 180 days or something not right is going to happen, then I would see the patient a little bit earlier and keep a little bit of close eye on this patient. So again, that might help in that regard. So the list goes on. I can talk about this for close to an hour, but at least I wanted to give you some basic synopsis of how this whole telegnosis has helped me. So in summary, telegnosis, which I call a forgotten ancient art, is useful in clinical medicine when incorporated with modern medicine. Our data showed 61% accuracy, but it was a small sample with more than 80% in half of the patients. The next thing, if the physician focused on advanced technology and opened their mind, incorporated this knowledge, all the patients would be greatly benefited. And based on these positive results of a sample study, a large randomized trial would bring validity to this unique modality. And I want to once again thank Mr. Himanshuray Raval for allowing me to do this initial first ever study on telegnosis in USA. And I'm glad that you are all learning. I hear that you all are from various different fields, policemen, lawyers, um, 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 astrologers, Ayurvedic practitioners, physicians. So you all come from various modalities, various field of interest. I have only presented telegnosis in medicine only, but I believe that it can help in many, many areas if we keep open mind, we embrace this ancient art, and we do methodical studies as Mr. Raval always believed. He always said, don't take my word, let's put it to test. So once again, uh, all the best to you. I hope that all the things that you learn in this course, that you would apply in your chosen field and benefited from there. Thank you so much.
Thank you for watching the video. This address was just played today on 27th March 2023 before a batch of the first certificate course on Telegnosis run by the biggest university of Gujarat. And I wish that Telegnosis is adopted and spread across the world to reduce the cost and confusion at all levels of our human life today, and the human race has benefited overall. Thank you very much. Thank you.